Hi, Dr. Ace Thayer here, Balance Focused Neck Adjustments. I'm with Cybele, and she's a phlebotomist. I love that. She draws blood for a living, and so she has poor posture, always bending over patients all the time. She has terrible low back pain, but that's not the interesting part. I'm going to help her with that right in front of the camera. You'll see this. But she had migraines when she was a kid, so bad that she used to hit her head against the wall. Her parents had to take her somewhere. They found nothing wrong with her. She used to throw up all the time. Terrible migraines. That's what all this started when she was a kid. So again, the phlebotomy, that's terrible. The poor posture is terrible. But again, this has been going on for years. And you get to watch her get better right before your eyes. Pretty simple case, pretty straightforward. Again, the story is the interesting part. Hope you guys like it. Like and subscribe. See you guys next time. Hi, Dr. Thayer here. I'm with Cybele. She's a new patient today, phlebotomist. She's always bending over, drawing that blood. And so she is in a lot of pain, and she's been in pain for quite a number of years, right?
Yes.
A little bit of history. She's had multiple surgeries, breast cancer surgeries. I don't think that's led to anything here. Her job hurts her, poor posture, poor balance. But I'm going to kind of turn it over to her. She needs this bad. She actually was so bad, she went to the hospital after her examination.
Yes.
And checked in because she was like, she was crippled. She said she was working, she fell to the ground, excruciating pain. I'll let her tell it, but Cybele, why are you here?
I'm here with lower back pain, neck pain. Just feels like my neck has always been just stuck. But I was working on Sunday. I'm a phlebotomist, so we do a lot of bending. People are in their beds in the middle of getting ready to draw a patient, and got up. It wasn't too far down either because I did lift the bed up. As soon as I got up, excruciating pain. I've had back pain like that just for the muscles, and it instantly went away. This one did not go away, and it made me drop to the floor.
Yeah. And so this is the worst episode ever.
Ever.
And you went, what did they do for you in the hospital?
All they did was take x-rays and make sure I didn't break a back or anything like that. They just said it was a muscle spasm, gave me some Tylenol, I took ibuprofen, and they gave me a muscle relaxer.
God, I love all those drugs, man.
Yeah.
You guys do a great
and
job.
I don't like to do a lot of drug things.
You guys are doing a great job with people. I love that. How much money? I don't want to ask.
Who
you,
knows?
A lot of money spent on nothing. I love that. I love that. It's so great. I love medicine. Okay. So anyway, she has some jaw pain, right TMJ. She has her sciatica now. She has pain down the L3 distribution down the quad. History of migraines as a child. Tell us about those real quick.
Growing up as a child, very little. When I was very tiny, I can remember at least 2 or 3 years old having migraines at least 2 or 3 times a month, to the point where my parents finally took me to get some images, and they said that there was no tumor or anything scary like that, but debilitating pain as in throwing up, not being able to walk, hitting my head against the wall as a child.
Yeah. So this back pain she has now is an extension of that, even though you guys won't put it together, but that's an extension of how bad her balance was when she was a child. Now she adapted to the pain by changing the way she did things, adapted to the pain by modifying her body, her physical body, so the headaches went away. About 18 years old?
16 years old, and I haven't had a headache like that since, and I'm 52.
And so she's exchanged one pain for the other. So anyway, she doesn't know this very much. Now tell us about the nausea too.
Nausea, it can happen whether I have an empty stomach or a full stomach. It can happen anytime during the day, it doesn't matter. That's within the last 3 or 4 months, on and off. I used to have nausea before, but nothing too bad. I think it, like I said, I had cancer treatments.
So it could be that.
Chemotherapy does damage.
Yeah, it does damage. Vision problems?
I had LASIK surgery probably 14 years ago. I now have to wear glasses to drive, but on the left side, it's more like a haze, blur, that's different than the right. I did see an eye doctor. There's no glaucoma or anything like that. They're just saying you have to wear
glasses. These are all, again, modifications, guys, of her imbalance. Also, used to have high anxiety, panic attacks.
Very much so. Panic attacks, of course, they put you on more medication to handle the panic attack. Those panic attacks started in 2004. Debilitating panic attacks, where I actually had to go to the hospital.
All extension of these early migraines, early problems, very young. I wish we would have got a hold of her when she was young. Would have changed her whole life for the better, but she's here now. Now tell us about your chiropractic intervention over the last couple of years. What have you done?
Basically, okay, they do the quick neck adjustment, the the back adjustment. They do your feet and chest, check your balance and stuff. I have never once heard of walking after an adjustment. Not once have I heard about that.
Okay, and then she went to a couple, and she went to one where they did this alpha thing.
And I went to it's not even, they don't call it chiropractic, it's called alpha biotics, a simple of trying to balance emotions and everything like that. That kind of scared me.
Kind of scared her. She also went to the last chiropractor. She came out worse. More vertigo.
Yes, went to the last chiropractor I went to. 2 days later, I had vertigo. And to this day, I think I still kind of ask my friends, "What am I walking to the right?"
Yeah. So she hasn't had a great experience with chiropractic. Only a handful of times in her whole life she's ever gone. Physical therapy. Have you done any physical therapy for your back?
Not for the pains. It's just for surgery stuff.
Surgery stuff.
Yeah.
And then any other doctors that have been involved in your treatment here besides ER stuff like that?
No.
Okay. Anything else you want to add?
No, I'm
Ready
good.
to get started?
Let's get it.
Let's get it on. Let's over here. Good. Touch your toes, please. Okay. Back pain. What scale? 1 to 10? What is that?
Back pain 4 or about a 5 or 6.
She also is wearing.
I'm wearing a brace.
Brace right now. Okay. So 5 or 6 right now. Go back like this.
No on the back. 8 to 9.
8 to 9.
That's it.
Okay. Now let's take the brace off right now.
Okay.
I'm gonna do this again. Oh, you got 2 on.
No, I have.
Is that a girl?
No. It's from my surgeries
Gotcha.
that I had.
Okay.
It's like a compression garment.
Okay. So now bend over, touch toes again. Better range of motion.
A little bit better.
Okay. How much pain?
The pain still around 4 or 5.
Gotcha. Stand up. So it's a tiny bit less. Looks like. Go and lean back now.
No, that's it, and still the same amount, 8 or 9.
8 or 9. Gotcha. Take a look at the floor of your neck. And so see how bad her neck range of motion is. What do you say when you look down? You said this a second ago. What is the feeling you have?
It's like it's stuck. It's stuck.
Stuck. Now look at the ceiling.
This is it.
And what is that? You said you've had this all your life too.
Yeah, since I can remember, I can't. When I look up, I'll just go bend my knees.
Yeah, she's always been stuck in that
Compensating.
position. So good. Now last one, squat to the ground, please.
No pain, but the balance is off.
Yeah. So we're gonna stand up. So when she went down, she's all stuttery and has problems with balance. And you can see that it's hard to see on camera, but really had trouble going down.
Yes.
Good. You ready to get started?
I'm ready. Let's do it.
Let's go on your back, please. Okay.
There we go.
Okay. Okay. So X-rays wise, nothing really horrible. I mean, obviously balance problems. Reverse curve in her neck, but nothing really horrible in there. All looks manageable. I'll point some stuff out. I'll mark some stuff. But again, definitely workable. Way better than I can imagine somebody having this many years of problems. So I was pleasantly surprised when I looked at X-rays. Still stuff to be worked on, but not as bad as I thought it was going to be. So check those out, guys.
I'm a little nervous.
You are?
Yes.
Okay. Now, how much pain is this when I question her? 2, 3, 4?
Like maybe a 3.
3?
Yeah.
I gotcha. Okay, just relax. She's so nervous, she's hot. She's like burning up. So let's take our time, right? Okay, you're just gonna relax the best you can. I'm not gonna rush you through this. I'm gonna give you a nice simple adjustment. No big adjustments, okay?
Okay.
Good. There you go. Just put in your position. I'm not rushing through this. And you've had your neck adjusted before, right?
Mm-hmm.
Okay.
Oh.
See, it's already starting to go. Do you self-adjust?
No, I don't. I'm scared.
I'm surprised. No. That start doesn't usually pop like that. Okay, let this go. Good.
Wow.
You guys didn't hear a lot because it didn't move a lot.
Oh, but I felt it inside.
It changed your voice even.
You did.
You felt it inside. That moved a lot for you.
I did.
Yeah, she's a control freak. Her body does not move. She has complete stiffness of her neck. But it did move.
It did.
And there's going to be a difference. So,
okay.
But it didn't move as much as it's going to move in the future. But
okay.
Good start.
Okay.
Okay. Sorry. See, it already starting to move. And hers was popping before it even moved. I think she's self-adjusting. She doesn't realize it.
I'm always afraid.
Yeah, it's really hypermobile in there. I'm sure it clicks a lot for you. So it's really hypermobile, guys. But we did get some motion in there. She's gonna feel a difference, and we can't wait to see how she does. Most important thing, to get upright, not to twist and turn.
Right.
And you're gonna look straight ahead.
Forward, hands down.
Perfect. I love that.
Recalibration.
Recalibration, baby. Good. How's this pain right here now?
You know what? I don't have any pain.
Yeah. Pushing the
Just pressure. That's it. Just knowing that your hands are there.
Feels different, right?
Right. Correct.
Gotcha. Okay, go ahead and sit up, please.
I'm dizzy.
Dizzy? A little bit or a lot?
Medium.
Medium? Good.
Yeah.
Okay. That's good. I say that in my videos. Why? Because I'm recalibrating the spine. I'm changing your balance center. It makes you feel dizzy. So being in line makes you feel odd at first. Make sense?
Makes sense.
So you're going to recalibrate and spread that good adjustment through your whole body. That's why we walk.
Okay.
Okay. Most important thing, relax. Look straight ahead. Go. There you go. That was better when you relaxed.
Let me just tell you that my back does not hurt. And I was having a hard time walking this morning.
You're just trying to make me look good.
No,
aren't you?
I'm serious.
You're a kiss ass or you kiss ass? When people
No,
say
I'm
it.
not a kiss ass. I'm done with that. I'm 52. It's enough kissing ass.
One more lap, please. One more
All
lap.
right.
How's the dizziness?
Dizziness is better.
Better? Okay. If you guys watch her, you can see that shoulder. See that right shoulder? You're right-handed, correct?
Correct.
Yeah, there's some serious problems inside that body of hers. Again, the x-rays don't show it, but you can see on the outside. So other things, you feel less pain right now? Other first things come to mind, other things right now?
I feel a release.
Good.
Feeling a release in the shoulders. But definitely I couldn't walk without feeling a bruise sensation in my lower back from the muscle spasm that I
And we
had.
took the brace off too.
Correct. I was kind of worried. Kind of worried.
Let's see how you feel. Bend over, touch your toes, please.
Oh, wow. The only strain I feel is from
Okay,
muscles, that's it.
Can you tell the camera? Because they don't believe you.
The only strain I
You
feel is
stand
from...
up, you stand
Oh,
up, down
okay.
there.
The only strain I feel is behind my legs, like anybody else who hasn't stretched their
So that
legs.
was a 4 or 5 out of 10 a minute ago.
I don't have any pain.
Gotcha. Let's go back now.
No pain.
That was an 8. You
Yeah.
said.
No pain.
We
like
did that
this.
multiple times in the room, huh?
Yeah.
And it was always an 8.
Yeah. No.
Like she doesn't want to stop.
No, I want to stay like this.
Gotcha. No pain?
No pain.
You're not exaggerating for us?
No, I'm not
Yeah.
exaggerating.
Because, the camera only makes me look good.
Right.
You don't have to make me look better.
No, okay.
Let's check your neck now. Can you look at the floor, please?
No pain, but I don't feel it as stuck.
Wow. Wow. Can you see, guys, look at the video before this. Look at the range of motion. Not the video, but the early stage. She couldn't even get close to this. It's so much better range of motion. Look at the ceiling.
That right there is the one I was going to test.
Yeah.
And it's
When's the
It's
last time you
still-
saw the ceiling?
normally with my legs straight. It's been a long time. Yeah. I mean, still a little bit of pain, but maybe at one or
Not
one.
stuck though, right?
No, it's not stuck.
Good. Look straight ahead. Last one. Squat to the ground. Now stand up. Any difference there? It was still a little off.
Still a little off.
A little off, yeah. She went down better, but it's still, she had a little problem with that left knee. She's kind of all over the place, but I could tell it was a little better, but I don't have to have her tell me it's better because we already know she's better overall.
Right.
So, what do you think of this experience?
I think it's a wonderful experience. At least made me not as fearful
Good.
anymore.
Now, can you tell them one last thing, and we'll finish with this? How does this, in reality, compare to what you see online?
In reality, it certainly is. You think that it's going to hurt. That is scary, but reality is it makes you feel a lot better afterwards. I feel a lot better. It's more the fear factor than pain factor.
Did you think it was going to be this fast?
I didn't think it was going to be fast. I thought, okay, well, I'll let you know. Because when I go home, I'll let you know
That's
if
what you
a
thought it was
day.
going to be like, right?
Yeah.
Even though you see it online all the
Yeah.
time, a little different in person.
Little
right?
different, very much so.
Thank you so much for the video.
Thank you.
Can't wait to work on you more.
All right.
See you guys next time.